Let's talk about the U.S. healthcare system. Everyone knows it's facing huge challenges. But what if the fix isn't just another policy debate or a new drug? What if it's a digital prescription? Today, we're breaking down how new technology and smarter strategies could actually fix one of our most complex problems. Okay, first, let's just try to get our heads around this number. $4.3 trillion. That is what the United States spends on healthcare every single year. To put that in perspective, that's more than the entire economy of Germany. It works out to almost 1 out of every $5 spent in the entire country. It's a staggering figure. But here's the paradox, right? All of that spending, it's not actually buying us better health. We outspend every other high-income country on the planet, but when you look at the actual results, the health outcomes, we consistently fall behind. So we're paying a premium price for a service that's under-delivering. That gap, that's the problem we're here to talk about. So, how do we start to fix this? Here's our game plan. First, we'll look at that paradox. Then, we'll explore what value really means and the two pillars that create it, reinventing how we deliver care and harnessing the digital tools that power it. And finally, we're going to talk about the one missing piece that most organizations overlook, the piece that really determines success or failure.
All right, let's jump in. Now, there is no single silver bullet here. Anyone who tells you there is selling something. The real path to creating value in healthcare requires a powerful combination, a dual-pronged approach that tackles two very different but totally interconnected areas.
Think of it like this. On one hand, you have the clinical workflows. That's the how care is actually delivered. On the other hand, you have digital innovations. Those are the tools. Now, you can have the most advanced AI in the world, but if your day-to-day process is a mess, the tool is useless. It's like putting a Formula One engine in a car with no wheels. And the reverse is true, too. A perfect process without the right tech just can't scale. Real transformation only happens when you get both of these working together, in perfect sync. So let's start with that foundation, the clinical workflows themselves. This is about so much more than what just happens inside a clinic or a hospital. It's about completely redesigning the system to be proactive, to keep people healthy from the start. And to do that, you have to understand this absolutely critical concept, social determinants of health, or SDOH. It sounds academic, but it's really simple. A person's health is shaped less by their doctor and more by their life. Things like their zip code. Do they have reliable transportation? Access to healthy food? These non-clinical factors are what really drive health outcomes. And ignoring them, well, that's what leads to all those incredibly expensive and often avoidable ER visits. So what if you could actually use that data strategically? The idea is to stop being reactive and start being predictive. You integrate the clinical and claims data you already have with this new SDOH data. Suddenly, AI can flag someone who's at high risk, and instead of waiting for a 911 call, you can step in early. Maybe you help arrange a ride to an appointment or a meal delivery service. You're solving a small, non-clinical problem today to prevent a massive, expensive clinical crisis tomorrow. This all fits into a managed process that creates a continuous loop of care. It begins proactively with things like annual wellness visits to catch issues early. Then, if treatment is needed, that care is coordinated. You're looking at physical and mental health together to treat the whole person. And crucially, the support doesn't end when the patient leaves the hospital. That transitional care at home is what finally breaks that horrible, costly cycle of readmissions. Okay, so that redesigned process is the blueprint. But a blueprint is just a piece of paper. To bring it to life, to make it work at scale, you need that second pillar, the digital tools that act as the engine for this transformation.
And of course, the minute you bring AI into healthcare, you have to talk about responsible AI. This is not a buzzword. It's a non-negotiable requirement. If the AI you're using isn't built from the ground up to be fair, transparent, and ethical, it's not just going to fail, it's going to be dangerous. It will amplify the very biases we're trying to fix and destroy patient trust before you even get started.
So where can this kind of AI have the biggest, fastest impact? Well, think of it as giving clinicians a set of superpowers. It can be an early warning system, detecting the subtle signs of something like sepsis or patient deterioration hours before human possibly could. It can predict risks,
Everything from surgical complications to which insurance claims are likely to be denied. Every single item on this list is a concrete way to save lives and cut out millions in wasted spending. These tools also completely change the patient's role in their own care. They're no longer just a passive recipient of services. They become an active participant. Tools like telehealth make it easier to see a doctor. Remote patient monitoring provides real-time data for managing chronic conditions. And patient portals, they give people the information and control they need to actually stick to their care plan.
Now, this right here might be the most important point of all. The biggest mistake anyone can make is trying to build technology in a vacuum. The only solutions that actually work, the ones that get adopted, are the ones that are co-designed. That means they're built with the clinicians, with the patients, and with the community members who are going to use them every day. If you don't do that, you're not innovating. You're just building expensive shelfware.
So you've got smarter workflows. You've got powerful new tech. You should be all set, right? Well, not quite. There's one more piece to this puzzle. And frankly, it's the missing piece that causes most of these big transformation efforts to fail. That piece is strategy. Because true innovation is something you have to lead, not something you can just buy.
A real strategy forces you to answer the tough questions. Do your leaders understand both the technology and the business? Have you actually prepared your organization for the cultural shift this will require? Can you build a rock-solid business case that proves the value to payers and policymakers? And do you have a clear plan to get this beyond a cool pilot and scale it across the entire organization? Without solid answers here, your innovation is likely dead on arrival.
In the end, it really comes down to this simple idea. Technology is actually the easy part. Lasting, meaningful innovation is built on a foundation of strong leadership, a clear-eyed strategy, and the organizational will to see it through. And that leaves us with this final question, a question for every leader thinking about this space. It is incredibly easy to get excited about the latest app or the newest AI model, but the real question is this. Is your strategy, your plan for your people, your processes, and your payment models, is that strategy as advanced as the tools you want to buy? Because how you answer that is what will ultimately determine the future.